If your child has a small head, does it mean he has Down syndrome? Let's be very clear. First of all, yes, it is one of the signs, but it is not entirely the only sign. You can't entirely say that a child has Down syndrome just based on one sign. So you need to take your child for professionals for assessment and be clear and sure what is the problem your child might have. But a small head or microcephaly, that's not entirely the only sign, because there are many children with small heads, yet they don't have Down syndrome. Let me first talk about the signs that even as a parent you can be able to see even when your child, even on the first day after giving birth. Let's say your child you find like he has one line in the palm. That's one of the signs that is common for Down syndrome children. But also you might find he has, let me talk like four signs. First, there is one line in the palm. Again, you find your child has slant eyes. Again, you find your child has a small neck, or he has a flat facial features. So those are signs that might indicate that your child, even small ears, those are signs that might indicate that your child has Down syndrome. But also when the child reaches around 2 years and you find he's slow at memorizing things, he's slow at speaking, he's slow at everything, those developmental delays, those are also signs. But you can't be sure until you take your child for assessment. So you first need to take him for assessment. But again, let's now put ourselves in a position whereby you find your child actually, he has all those things we have said. He has a small head, he has one line in the palm, the neck is short, he has slant eyes, he has flattened facial features, and you've taken him for assessment, and you are now sure that your child has Down syndrome. What should you do? First of all, don't panic. Parents, the same way with speech delays, whereby early intervention changed a lot of things, there are many Down syndrome children right now who wins champions. Others are bodybuilders. Others are good pianists. Others are good artists. Others are good painters. So it doesn't mean that is the end for your child. What is very important is, what are you doing now? Are you going to let him be? Are you going to just wait until he's 7 years, maybe miraculously wait to see if something changes in the future? That's not the best way to go, because you are denying him the best time for treatment. We've seen with that intervention, Kunga therapy, speech therapy, occupational therapy, children can be trained. The brain muscles can be trained. Even us as older people, we train our muscles. You can train your brain to observe some habits. Let's say to wake up at 6 every time in the morning. You can train your mind. Let's say you are 40-something, you are 50-something, and your memory is a little bit going down compared to how you were before. But the more you try to train your brain to read, let's say today you are reading 30 minutes for a whole month every day, and the second month you read 1 hour, the second month you read 2 hours every day, and then you find after 6 months your brain has changed and has almost gone like back when you were still in high school, and your memory is very sharp. The same way things can change for children. For them, it's even easier. Because first of all, there are some new neurons which are not yet formed because of neuroplasticity. And the more you engage your child, first of all, in with an intervention, having Kunga therapy, speech therapy, occupational therapy, taking him to play with other children, you are going to solve the problems of social interaction. The more he plays with other children, the more he's going to develop his speech, the more his memory is going to be sharp, the more his eye contact is going to be sharp, the more his attention is going to be sharp. And you are doing all those, again, also taking him for treatment. You can be able to change a lot of things. But like we always say, when you do this before 3 years, you can be able to change I've seen many children with Down syndrome who are studying with other kids and are performing like others. But when you look at the parents and they tell you their stories, you find they started intervention at an early age. They started taking the child for therapy when he was 1 year. Because Down syndrome, unlike autism, many signs you can see them even before 6 months. So what matters, the problem is not that your child has Down syndrome. The problem is, what are you going to do about it? Let's suppose your child is 1 year. Let's suppose your child is 2 years. If you let him be, of course, it's very rare to say that someone who is 9 years or 10 years can be able to improve with the intervention compared to a child who is 2 years or 1 year. So not just affecting their physical features, Down syndrome also affects their cerebellum. There are many children with Down syndrome. You find cerebellum is a little bit small compared to the brain of other kids. And therefore it ends up causing them to have low muscle tone in their system. So if you take him for Kunga therapy, for speech therapy, for occupational therapy, you can, especially occupation and Kunga, you can be able to deal with that low muscle tone. And again, you engage him to play with other kids. Those are simple. Also, there are some remedies you can do if you don't have capacity, or maybe you are in a faraway place where you don't have access to the centers like Kunga, speech, and others. You can try to engage your child to play with other kids, to talk with other kids, to engage other kids, to try to make him talk, to try to make him engage. So the more you train his brain, and at an early age, you can be able to achieve wonders. So what matters, or the problem, is not that the child has Down syndrome. The problem is, what are you doing about it?